Hey everyone, welcome back to my channel. In the beginning, I must state that this video is for informational purposes only and is not medical advice. Today, I'm going to tell you about the organ that quite literally keeps us alive and kicking, the mighty heart. It's not just a symbol of love and emotion, it's a tireless workhorse that pumps life-giving blood throughout our bodies every second of every day. So let's explore the incredible world of the heart, from its anatomy to its functions, and even some surprising facts that might just make you appreciate this vital organ a little bit more. Fun fact, the average human heart beats about 100,000 times a day, 35 million times a year, and over 2.5 billion times in an average lifetime. That's a lot of pumping. First things first, let's get a lay of the land. Your heart is a muscular organ about the size of your fist, located slightly left of center in your chest. It's divided into 4 chambers, 2 atria on top and 2 ventricles below. It's like a well-organized house, with each room having a specific purpose. The atria are like the receiving rooms, collecting blood from the body and lungs. The ventricles are the powerhouses, pumping blood back out to the body and lungs. And the whole system is controlled by electrical signals that act like a conductor, keeping the rhythm steady and strong. The sound of your heartbeat, that familiar lub-dub, is actually the sound of your heart valves opening and closing as they regulate the flow of blood. Now, let's talk about the heart's main job, pumping blood. It's like a delivery service, constantly transporting oxygen and nutrients to your cells and removing waste products like carbon dioxide. This continuous circulation is what keeps your organs functioning and your body thriving. But the heart doesn't work alone. It has a network of blood vessels that act like highways, carrying blood throughout your body. Arteries carry oxygen-rich blood away from the heart, while veins carry oxygen-poor blood back to the heart. It's a complex system, but it's incredibly efficient. Did you know that if you stretched out all the blood vessels in your body, they would extend over 60,000 miles? That's enough to circle the Earth more than twice. Now let's get into some of the factors that can affect heart health. Just like any machine, your heart needs proper care and maintenance to function at its best. Things like a healthy diet, regular exercise, managing stress, and avoiding smoking are all crucial for keeping your heart happy and healthy. Laughing is good for your heart. It releases endorphins, which can help lower stress hormones and improve blood vessel function. So, don't be afraid to let loose and have a good laugh. But even with the best care, sometimes things can go wrong. Heart disease is the leading cause of death worldwide, and it includes a wide range of conditions, from coronary artery disease to heart failure. It's important to be aware of the risk factors for heart disease, such as high blood pressure, high cholesterol, obesity, and diabetes. If you have any of these risk factors, talk to your doctor about ways to manage them and reduce your risk of heart problems. It has been found that the ancient Egyptians believed that the heart was the center of intelligence and emotion. They even weighed the heart during the mummification process to determine if the person had led a good life. I am going to tell you further on one of the heart issues, bypass surgery. Now don't worry, I won't bore you with medical jargon. We'll break it down in simple terms, so you can understand what it's all about and why it's sometimes necessary to mend a troubled heart. The first successful coronary artery bypass surgery was performed in 1967 by Dr. Rene Favaloro in Cleveland, Ohio. It revolutionized cardiac care and has saved countless lives since. So what exactly is bypass surgery? Think of your heart like a house with plumbing. Your coronary arteries are like the pipes that deliver fresh water, blood, to each room, part of your heart. But sometimes, these pipes can get clogged with gunk, plaque, making it hard for the water to flow freely. That's where bypass surgery comes in. It's like calling a plumber to fix those clogged pipes. But instead of clearing out the blockage, the surgeon creates a detour, a bypass, using a healthy blood vessel from another part of your body. This new route allows blood to flow around the blockage, delivering much-needed oxygen and nutrients to your heart muscle. The most common blood vessels used for bypass grafts are the saphenous vein from the leg or the internal mammary artery from the chest. It's like recycling, using what you already have to fix a problem. Now, who needs bypass surgery? It's not for everyone, of course. It's usually recommended for people with severe coronary artery disease, where the blockages are so bad that they're causing chest pain, angina, limiting your activity, or putting you at risk for a heart attack. The decision to have surgery is a big one, and your doctor will consider various factors like your overall health, the severity of your blockages, and your individual preferences. It's a team effort, so don't be afraid to ask questions and be involved in the decision-making process. The average bypass surgery takes about 3-6 hours, and most people stay in the hospital for about 5 to 7 days afterward. It's not a walk in the park, but it can significantly improve your quality of life. So what happens during bypass surgery? It's a pretty amazing feat of modern medicine. The surgeon will open your chest and connect you to a heart-lung machine. This machine takes over the job of your heart and lungs while the surgeon works. They'll take the healthy blood vessel graft and attach one end above the blockage and the other end below, creating that new detour for blood flow. After the bypasses are created, the surgeon will disconnect you from the heart-lung machine and allow your heart to take over again. It's like rewiring your house's plumbing to ensure a steady flow of water to every room. Fun fact, during bypass surgery, your heart is actually stopped and cooled down to protect it while the surgeon works. It's like putting your heart in a temporary hibernation mode. Now, recovery after bypass surgery is a journey in itself. You'll spend some time in the hospital, where the medical team will monitor you closely and help you manage any pain or discomfort. Once you're home, it's important to follow your doctor's instructions carefully, including taking your medications, eating a healthy diet, and gradually increasing your activity levels. It may take a few months to fully recover, but many people find that their quality of life improves dramatically after bypass surgery. They can breathe easier, have more energy, and get back to doing the things they love. The first minimally invasive bypass surgery was performed in 1995. This technique involves smaller incisions and less time on the heart-lung machine, leading to faster recovery times and fewer complications. The first successful human heart transplant was performed in 1967 by Dr. Christian Barnard in South Africa. Since then, thousands of lives have been saved thanks to this groundbreaking procedure. Remember, bypass surgery isn't a magic bullet, but it can be a life-changing procedure for people with severe heart disease. If you're considering it, talk to your doctor about the risks and benefits and what to expect during recovery. It's a big decision, but it could be the key to a healthier, happier life. Fun fact, the human heart is so powerful that in a single day, it generates enough energy to drive a truck 20 miles. Let's talk about arrhythmias. Ever felt your heart skip a beat or race unexpectedly? That's an arrhythmia, which is basically an irregular heartbeat. Sometimes it's harmless, like a little hiccup in your heart's rhythm. But other times, it can be a sign of a more serious problem. Think of it like a car engine misfiring. It can still run, but it's not working as smoothly as it should. There are many different types of arrhythmias, some faster than normal, tachycardia, some slower, bradycardia, and some just plain irregular, atrial fibrillation. Treatment depends on the type and severity of the arrhythmia, but it can range from medication to lifestyle changes to even procedures like ablation, where doctors use heat or cold to destroy the abnormal heart tissue causing the irregular rhythm. Fun fact, the world's oldest person with a pacemaker lived to be 112 years old. Pacemakers are small devices that help regulate heart rhythm, and they've come a long way since they were first invented in the 1950s. Now, let's move on to heart valve problems. Your heart has 4 valves that act like doors, opening and closing to control the flow of blood through your heart. But sometimes, these valves can become damaged or diseased, making it harder for your heart to do its job. It's like having a leaky faucet. It can waste water, blood, and put extra strain on the whole system. There are a few different types of valve problems. Stenosis is when the valve opening becomes narrowed, making it harder for blood to flow through. Regurgitation is when the valve doesn't close tightly, allowing blood to leak backward. And prolapse is when the valve flaps bulge or flop back into the atrium. Treatment for valve problems depends on the severity and type of the problem. Sometimes, medication is enough to manage symptoms, but in more serious cases, surgery may be needed to repair or replace the damaged valve. The first successful human heart valve replacement surgery was performed in 1960 using a mechanical valve made of metal and plastic. Today, there are also valves made from animal tissue, which often require less long-term medication. We've also got heart failure, which is when your heart can't pump blood effectively. It's not that your heart has completely stopped, but it's like a weak engine that's struggling to keep up. Heart failure can be caused by a variety of factors, like high blood pressure, coronary artery disease, or a previous heart attack. Symptoms can include shortness of breath, fatigue, swelling in the legs or ankles, and difficulty lying flat. While there's no cure for heart failure, there are treatments that can help manage symptoms and improve quality of life. These can include medication, lifestyle changes, and in some cases, procedures like heart transplants or ventricular assist devices, VADs. Did you know that the human heart has its own electrical system that generates the signals that tell it when to beat? This system is so powerful that it can generate enough electricity to power a light bulb. Remember, your heart is a remarkable organ, but it's not invincible. It needs your care and attention to stay healthy. By understanding these common heart issues and taking steps to protect your heart health, you can reduce your risk of developing problems and live a longer, healthier life. If you have any concerns about your heart health or are experiencing any symptoms, don't hesitate to talk to your doctor. They can help you understand your risks, recommend appropriate screenings, and develop a personalized plan to keep your heart beating strong. Now let's talk about some of the amazing advances in heart health. Medical technology has come a long way, and today, we have incredible tools and treatments to help people with heart conditions. From minimally invasive procedures to advanced medications, there are more options than ever before to keep hearts beating strong. Researchers are also constantly exploring new frontiers in heart health, such as regenerative medicine and stem cell therapies. While these are still in the early stages of development, they hold the promise of repairing damaged heart tissue and even growing new hearts. So there you have it, folks. The heart is a truly remarkable organ, worthy of our admiration and care. By understanding its anatomy, functions, and the factors that affect its health, we can take steps to protect this vital organ and keep it beating strong for years to come. Thanks for joining me on this journey into the heart. If you have any questions or comments, please leave them below. And don't forget to like and subscribe for more health-related content. Take care of yourselves and your amazing hearts.